Hi everyone, my name is Samantha Martinez and I will be doing my presentation on the psychological disorders and the effects they have on people. So let's start with what is a psychological disorder. A psychological disorder is an ongoing pattern of thoughts, emotions, and behaviors that can cause someone immense distress and changes in their day-to-day life. A few examples of psychological disorders are anxiety disorder, clinical depression, PTSD, which is post-traumatic stress disorder, and even OCD, which is obsessive compulsive disorder. So let's start off with anxiety disorders. Anxiety is typically the feeling of nervousness or agitation that something is going to happen. It doesn't only affect you mentally, but physically as well. Anxiety doesn't only consist of nervousness. There are different types of anxieties, such as social anxiety, separation anxiety, panic disorder, and even OCD. Although these are all different types of anxieties, the symptoms are all quite similar. Some signs and symptoms of anxiety consist of excessive worry, irritability, sleep disturbance, poor concentration, restlessness, muscle tension, and even fatigue. So, let's talk about depression. Depression is a mental health disorder that causes people to feel a constant depressed mood or loss of interest in activities that they used to love, making it very hard to go about their daily lives. There are a few different types of depression, and a few are seasonal depression, bipolar depression, and clinical depression. Although depression is a very challenging thing to live with, there are a few therapies that you can do to help manage it. One would be going for a walk, changing your diet, meditating, taking your vitamins, turn off your screens for a bit, visiting some friends, finding some support, talk to your doctor about medication, staying focused, and trying to stay hopeful. So, next is PTSD, post-traumatic stress disorder. Post-traumatic stress disorder is a mental health disorder that is triggered by a terrifying event, either from witnessing it or experiencing it. This is a condition that can affect everyone of all ages and genders, but studies show that a large percentage of people who suffer from PTSD are veterans. Treatments for PTSD consist of therapy, trauma-focused psychotherapy, and even medications. Now, a few symptoms of complex PTSD would be difficulties in relationships, helplessness, loss of faith, loss of self, flashbacks and nightmares, triggers, altered attention, and consciousness. So next, we're going to get into personality disorders. What is a personality disorder? A personality disorder is a type of mental disorder in which you have a rigid and unhealthy pattern of thinking, functioning, and behaving. The effects of these disorders tend to last over time. Some examples of personality disorders consist of borderline personality disorder, schizotypal personality disorder, antisocial personality disorder, and even dissociative identity disorder. Borderline personality disorder, which can also be called BPD. Borderline personality disorder is a serious mental condition characterized by pervasive instability in moods, relationships, self-image, and even behavior. BPD can cause people to have very intense emotions that causes them to feel misunderstood. BPD has very special symptoms that you wouldn't really find in another disorder, such as favorite person. People with BPD may experience the symptom favorite person, which is when they pick someone and depend on them to be their source of balance. This may be subconsciously, but the dependence on that other person is there. They can even tend to revolve their world around their favorite person. So 10 signs of borderline personality disorder would be impulsive and risky behavior, such as risky driving, unsafe sex, gambling sprees, or illegal drug use. 2. Awareness of destructive behavior, including self-injury while often feeling unable to change it. 3. Wide mood swings. 4. Short but intense episodes of anxiety or depression. 5. Inappropriate anger and antagonistic behavior, sometimes escalating into physical fights. 6. Difficulty controlling emotions or impulses. 7. Suicidal behavior. 8. Feeling misunderstood, neglected, alone, empty, or hopeless. 9. Fear of being alone. 10. Feelings of self-hate and or self-loathing. So, let's get into schizotypal personality disorder. Schizotypal personality disorder is an ingrained pattern of thinking and behavior marked by unusual beliefs and fears and difficulty with forming and maintaining their relationships. Schizotypal personality disorder sometimes gets mistaken as schizophrenia, so getting a diagnosis takes time and it is quite difficult. People with schizotypal personality disorder may be seen as odd, eccentric, and may even have magical thinking. Okay, last but not least is antisocial personality disorder. Antisocial personality disorder is a mental health disorder in which people have no regard for others. People with antisocial personality disorder may be irresponsible, act in criminal behavior, act impulsively or aggressively, and they may have a hard time maintaining their relationships and friendships. Symptoms can be seen at a young age, but they may lessen over time. And since symptoms are seen at a young age, there can only be a diagnosis once they reach adolescence or adulthood. So, how can we help our mental health now? Fixing one's mental well-being takes time and patience, but it can be done. There are many different things you can try to do to better yourself, some being meditating, journaling, exercising, or even going outside, or talking to a therapist or a loved one. Maintaining one's psychological well-being is a very hard process that can't be done alone, so you will need support from your loved ones. Alright, that was my presentation on psychological disorders. I hope you enjoyed. Thank you for listening.